Okay.
Okay, well, good evening. It's Tuesday, February the 5th. This is the Rotary E-Club, a District 7710 program, and we'd like to have our guest speaker, Denver Jameson, be introduced by our first Rotary E-Club President, Kevin Primus.
Have Denver speak with us tonight. I've gotten to know Denver through the Partnership for a Healthy Durham.
Please speak up, Kevin.
I'm sorry, is my microphone not too strong? Okay, I'm back. Really excited to have Denver speak with us tonight. I met Denver through our Partnership for a Healthy Durham, where she serves not only on the partnership, but also as the epidemiologist for Durham County. And Denver's very humble, so she doesn't always emphasize the fact that she was Durham County's first epidemiologist. And so she does a lot of work with the partnership and a lot of work for the county, but in her background is actually in economics, which you might wonder how she got into public health, but a lot of the statistics that drives her career has an understanding or a foundation in economics. And so I think as Rotary, I'm really excited to be a part of an organization that does care about one of our areas of focus being disease prevention and treatment. And so epidemiology is really critical to that. So I'm really excited to hear what Denver has to say. Her undergraduate degree is from the University of North Carolina at Wilmington, and she got her master's from Tulane University and has worked with the Louisiana Public Health Institute and has been a program manager at the University of North Carolina at Chapel Hill, a data analyst for the North Carolina State Center for Health Statistics before becoming Durham County's first epidemiologist. And so if that doesn't make you embarrassed enough, Denver, here we're glad to hear what you have to say about the community health assessment and racial equity.
Thank you. So slight change of plans. I'm just going to be talking on the community health assessment today. And the timing of this is actually very good, and I'll explain that in a few minutes. But first, we'll start off at the beginning with the community health assessment. So we do a health assessment every 3 years, and it is part of a state mandated requirement for us and for Duke Hospital System. So we've been working collaboratively with the Duke Hospital System to come up with a community health assessment for, I don't know how many years, but it's been a very long time. So it's been a collaborative process, and generally the process that we take is we start off by collecting data through a random sample of community households throughout Durham County. And we do two samples. We do one specific to neighborhoods with high proportions of Latinx population, and then we do one with a more broad community where just anybody who lives in Durham County can be selected to participate. And after we collect that data, we use it to help us set priorities, and that's a very community-involved process where we present the data back to community members and we talk about what it means, what things should be prioritized, and together we come up with a decision about what the top issues are. And then we use those priorities to create action plans. And this is actually the point that we're at with our current health assessment is creating action plans. And I'll talk a little bit more about that in a few minutes. So the interesting part is because we take a collaborative approach, it takes a really long time to do this process. So even though we're kind of at the end of our 2017-2018 health assessment, we're now beginning to talk about the next health assessment and collecting data for that. So we're kind of in bucket 1 and bucket 3 here, and I'll explain more about that as we move on. So the reason that we do the health assessment is because we have to be accredited as a health department, but it's also really helpful for us to do it. So it helps us prioritize our resources. There's a lot of things that we could be working on in Durham County, but hearing directly from the community helps us to prioritize and figure out what issues are the most important and what we should be focusing our time and resources on. It also helps support community conversations. So something we're hoping to start doing in the health assessment from here on is to involve community members and more of our work at the health department on an ongoing basis. But I think most people would probably agree that 10 years ago, that wasn't something that was done very often. So this was a touch point with community members where they were given an opportunity to provide input every 3 years at a minimum. And then we also produce a really big report that's gotten smaller in a good way. So in 2015, I think the report was almost 1,000 pages, and we've gotten it down to about half of that. So there's a lot of information in there, and each section is limited to 5 pages. So I will say that the entire report seems large and can be overwhelming, but if you are looking for something very specific, that the information isn't going to be too much to read through. It's just 5 pages. So if you haven't seen the health assessment before, I would encourage you to look at it, and it's available at healthydurham.org. Okay, so I want to talk a little bit about what our health priorities are from the last assessment. And as I mentioned, right now we're in the process of creating we call them community health improvement plans actually, but those are based off of the feedback we get from community members in the listening sessions we do. And then we use that information in conjunction with, we have to marry that with what we're able to do given our capacity at the health department, and then also who's involved through the partnership. So this reminds me that I have not really explained very much about the partnership. Kevin, do you all know much about, okay, so I'll give a really brief explanation of what the partnership is. The Partnership for a Healthy Durham, I believe, is in its 11th or 12th year now. It's a really strong community collaboration, and it is coordinated by someone who works at the health department, but really the strength of it is in its members. So there's membership from over 500 people in Durham County, lots of different organizations in the community, and then also Duke and residents are participating. And there's 4 committees that are based off of the health assessment priorities, and then we also have a communications committee, which is the committee that Kevin co-chairs. So the co-chairs are elected by the members, and then together the members and the co-chairs help drive this process that I'm talking about right now, which is creating community health improvement plans. So I want to start off by does that make sense to everybody? Does anybody have questions about that? And please interrupt me at any time. This can be very informal, and I want to make sure that I'm answering your questions if you have any. So what we found in our last health assessment is that affordable housing was the #1 thing that people were concerned about in Durham County, which is interesting because that wasn't one of the priorities in the previous cycle. So this shifted the work that we were doing. We had to drop something that we were working on before, and we started working on this. So this is an example of how we evolved to meet the community's needs as we hear about them. So in total, 71% of residents said that affordable housing is the top issue in Durham County. And as I mentioned, this is a new committee. So this is one where we don't even have co-chairs elected yet. So if you're interested in affordable housing, I would also encourage you to participate in this work group, because it's really at its foundational stages right now, where we're talking about how we want to do the work from the very beginning. But some of the recommendations that we heard from community members were that we should be talking about capping property taxes. This was particularly important for older adults, so people who may have lived in their houses for 30, 40 years and have paid it off but can't afford to keep living there because property taxes are increasing as houses are selling for more around them. We also heard that people wanted to hold landlords accountable for maintaining properties. So one listening session comes to mind in particular when I think about this, and the residents who attended that listening session were talking about some really terrible living conditions, it sounded like, and it seemed that there were 1 or 2 landlords who owned really large complexes and they were in disrepair. And when residents would request these landlords to repair things, there were some retaliatory things happening where residents were essentially being pushed out if they kept complaining, and there was mold and the carpets were like brown and people were developing chronic health conditions because of living in these spaces. And what we were hearing from residents is that they they wanted a way to hold landlords accountable beyond the court system even, because that can be very financially consuming and time consuming to go through. So they suggested even having a process where a complaint system that could be created where they could complain about landlords, and if there were repeat offenders, that there was some sort of action that could be taken through the county. So they also talked about including residents in development plans as the city council continues to think about how we develop the city and county. And they wanted to control rent prices and implement inclusionary zoning. So some of those things as a health department we can't tackle because we don't, because of where we're at in government, we're not allowed to provide policy recommendations like that. But what we can do is look at the data around these issues and provide resources for people who would like to lobby on these issues. So we haven't come up with a specific action plan yet, but that's something that's in the works. So if you're interested in affordable housing, they meet at the health department on the third Thursday of the month from 8:30 to 10. And Marissa Mortaboy, and I can send her email address out afterwards, would be the person to get in contact with more information. Any questions there? Okay. So the second most identified issue from the health assessment was access to healthcare and insurance. So this is one of the committees where we do have an action plan. So I'm going to give you some specific things that they're working on. So, and the things that I'm naming are specific to recommendations that came out of the listening sessions of the survey. So residents were asking about increasing awareness of affordable health care and resources and insurance options. So that's something the committee is working on. They're looking at working with existing groups. Georgina Dukes heads up the Durham part of a new resource. It's an online resource database, and I think it's called Unite Us. We'll be talking about this in detail at the next Access to Care meeting, which is the second Thursday of the month. I think that's next Thursday from 8:30 to 9:45. So if you're interested in learning more about that, I'd suggest coming to the meeting. We're also trying to work on facilitating some racial equity training opportunities for our patient care teams in Durham, and also wanting to increase the number of patient navigator roles in healthcare settings across Durham. That was another thing that kept coming up, is that residents found it particularly hard to navigate the health systems, find out what their options were for insurance, and even if they had insurance, they weren't always quite sure what their insurance covered. So we're trying to create some resource guides and then also increase capacity within the healthcare settings themselves. Okay. The third most identified issue was mental health. So 55% of our residents said mental health was a top issue in Durham County. This was an existing committee that we had in the previous cycle, but we used to have it combined with substance use as well. And now that part has been broken off because there's a number of other groups who are already working on that issue, and we felt it would be best to kind of separate them so that there wasn't so much overlap at the meetings. And this is another topic where we haven't developed out the community health improvement plan. So if you have a strong interest in mental health, it'd be great for you to get involved and help us think through what exactly we're working on in relation to mental health. Those meetings are the third Thursday from 3 to 4:30. And I can tell you a little bit about what came out of the listening sessions in relation to mental health. People expressed interest in training police officers and first responders on how to interact with people who are dealing with mental illness. They were also interested in creating some sort of anti-stigma campaign and finding people who are comfortable talking about mental health issues that they go through in a public platform, so that it would help start to destigmatize some of the mental health barriers and seeking care. And there was also interest in providing culturally competent and integrated healthcare. So a lot of residents were talking about how when they go for mental health care services, they have to go to this place over here. And then when they go for primary care, it's at this other place. And it makes it very difficult to coordinate their care between providers, but then also just on themselves because they have to go to so many different locations. So I don't know that there's something we can do about that at the health department, but that's something that we can have a broader conversation with some of the other systems in Durham about. Okay, and then our last committee that's based off of the priorities is a mouthful. It is obesity, diabetes, and food access. And 46% of residents said that these were issues that they thought were affecting Durham the most. So some of the recommendations that came out of this were to provide culturally appropriate physical activity and diet recommendations. And what the committee decided to do was to work on a campaign that shifted the narrative around sugar sweetened beverage intake from focusing on individual behaviors to focusing more on the companies who are targeting low-income neighborhoods and people of color. The committee is also working on offering healthier lunch options. If there's anybody with kids who's on this call right now, you're probably familiar with, in particular, the breakfast options. They can be, from what I've heard, that they're sugary, or there's a perception that they're not very healthy. And whether or not that's true, the perception of them being not healthy contributes to people not sending their kids to school to eat lunch. So what happens because of that is the nutrition department at Durham Public Schools doesn't have enough money to contract with somebody to create higher quality lunches. So it's kind of a chicken and the egg situation, where if they had more money, they could provide higher quality lunches, but that would require parents trusting in the system to provide higher quality lunches and breakfast. So it's a really complicated issue, but something that the Obesity, Diabetes, and Food Access Committee is working on, trying to shift culture and think about some creative solutions to increasing the funding so that DPS can get the quality lunches and breakfast that they want to be able to provide to students. So if you're interested in attending those meetings, those are on the second Wednesday from 8:30 to 10 a.m. Okay, so what I'm really interested in talking to you all today about, I wanted to give that background so you understand what the health assessment is and how we're using the data, but I'm really interested in talking to you all about our upcoming survey. So right now we're in the process of putting together survey development teams. And once we get those teams together, we'll be thinking through what questions from the last survey we want to take off, which questions we want to add, how we might change answer choices. Really nothing's off of the table. And this is what I have here on the screen is a summary of the types of questions that we included in our last survey. I want to say that it was somewhere around 60 questions. It was pretty long. It took about 30 to 40 minutes to get through, and the only thing that we were providing people who took the survey was hand sanitizer, so it's a big burden. So we want to get those survey times down, and in order to do that, we need to remove some information. So I can give you a few examples of the types of questions that we ask within these domains. Emergency preparedness, we're asking people if they have kids and where they would go if there was an emergency in their community. We ask people how they get their health information and whether or not they trust the health department as a source of information. We ask a lot of questions about personal health. We ask people to assess their own mental health, their own physical health. We ask them about their stress levels, what contributes to their stress. We ask about their experiences of racism and discrimination, and we ask about their ability to get insurance. We also ask quite a few questions about exercise and diet, and the exercise questions last time, a lot of them were, this was around the time when Durham County was creating the bike walk plan, so there were some questions that were being used there that we may be able to take off. We also asked questions about access to healthcare, a few about smoking and other tobacco product use, a question about what people's primary mode of transportation is, whether or not they or someone in their families experienced addiction, and then questions about community improvement, which are how we identify the priorities. So this is kind of a broad overview of the types of questions that are included. So I'm really interested in hearing from you all about any questions that you'd like to see included in the next survey, if you have ideas now. And if you don't, that's okay too. I have a survey that I was hoping to send out after this presentation so that you can provide your input there if you need a little bit longer to think about it. But does anyone have any questions about the survey or ideas about questions that you'd like to see included?
Denver, this is Eve. I was, I guess the topics. Can you show the list again? Just to,
Yeah.
Awesome, thank you. So I live in North Durham, and I know from the neighborhood compass that our health is not great up here. So I'm just curious about like maybe just sidewalks or are there questions about sidewalks in the survey, and like if people would use them to get to the bus stops or anything? I'm just curious about that.
I don't remember all the questions about the sidewalks, but we did ask things like, would you walk more? We asked questions about what people's barriers are to walking, and not having sidewalks as one of the barriers listed. And we asked people if they had sidewalks, trails, and greenways, if they'd walk more. But those are the only questions that are coming to mind. Was there something else in particular that would be helpful to include?
No, I'd have to think about it a little more, but I was just curious. But I'd love to see the survey. So.
Yeah, I can also send the full survey out to you all. It's lengthy, but if anyone's willing to look at it and provide feedback, that would be very helpful.
Definitely. Thank you.
Denver, do you happen to have a link you can put in the chat window here? We could have folks get it from there.
Yes.
Or if you want, you can give it to me after email me, and I'll put it in our newsletter or what have you to get out to the community as well.
Okay, I can copy and paste the link in after I stop sharing my screen and close it out and go back through my email.
Okay. I had a question about all of the housing information. I guess health and housing, I guess I could see them going hand in hand, particularly if you have lead paint and, different issues with your house, like you said, mold and so forth. But it sounds like you're saying that you are addressing housing issues as well as part of this. How closely related? What other things are you looking for when people are you saying that you asked a question and they responded with housing issues, and that's why that's a topic that you have? Or do you typically have housing as part of your health assessment?
I don't know if housing was included in the survey from 2013, but what we did in 2016 is include it in options for the issues that are affecting communities broadly, and that's how it was identified. So people didn't have an opportunity actually to provide more specific information about how affordable housing was affecting their communities, but that's kind of what we were hoping to find through it's actually called the Health and Housing Committee, the newly formed committee, and then also through the focus groups that we conducted, trying to dig a little bit deeper to find where the intersection of health and housing is in Durham and how we can address some of those things. So just as an example, at our last Health and Housing Committee meeting, we asked Neighborhood Improvement Services to come and talk to us about how their complaint system works and what they do when they go to a house that's been cited. And they do an amazing job and they do a lot of work, but there's nothing in the Durham Housing Code that talks specifically about health. So for example, there was somebody who participated in a listening session that was talking about carpets being so dirty that this person had to buy blankets to put over the carpets, and their son got asthma, which we obviously can't say was for sure because of the carpet, but it was certainly something that contributed to asthmatic, I'm not familiar with the terms, but probably outbreaks is how you would describe that. But those types of things aren't being covered through the housing code as it is written now. So that's an example of something that we could try to work on as a health and housing committee.
So would you, if the carpets are dirty, would you be replacing the carpets? Would you be cleaning the carpets or buying vacuum cleaners? And how do you address that? You could talk about the issues, but then how do you actually address them? Just an example.
Yeah, so in that example, the ideal solution would be the health health factors are included in the housing policy that Neighborhood Improvement Services is enforcing. So if it were included, then when an apartment building or a house is cited, they could look for issues that have an impact on health, and they could cite the landlord for that. So that the landlord has to replace the carpet or clean it or whatever it takes to get it up to a standard that seems reasonable.
Got it.
Yeah.
Thank you. Anyone else?
Denver, can I ask just one more question? This is Eve.
Yeah.
So I'm wondering if there is a space to ask about opioid or substance abuse. Is that under one of the personal health topics, or is it considered too invasive, or like how is that addressed as a healthcare issue within the survey?
If I remember right, I think it's only included in, there's 3 really long questions at the end of the survey. And when I send it out, those might be the best places to go look for feedback.
Okay.
I think it's included as an option, as it's worded something like, what are the biggest topics that are affecting quality of life in Durham? And substance use would have been an option, but that's really as far as we go. And we never said anything specifically about opioid use. So if you have ideas about ways that we can incorporate something more specific related to those topics, that would be really helpful to hear too.
Okay.
And I realize you may not have an answer right now, but if you think of something later, let me know.
Thank you.
Mm-hmm.
So Denver, this is Kevin again. What is that process then once you get the feedback on the survey itself?
Mm-hmm.
Who is going to be deciding what those final survey questions are? How does it go from people submitting survey ideas to that final survey being agreed upon?
That is a very good question. So what happens is right now I'm in the process of putting a survey development team together. So quick plug on that too. If anyone here is interested in joining that effort, let me know. But what I try to do is find a group of people with representation from the city and county government, from a few different Duke departments, because Duke's been described to me as a 2,000 villages. So I try to make sure there's some coverage from more than one place in Duke. And then community organizations with no ties to Duke or the health department or city county offices, and then a few residents. I'm hoping to find maybe like 10 to 12 people. So what will happen is we'll look at some things using just strict kind of like logic. For example, if there's a nested question where only 3% of the people answered the question, we might just remove that because it's not providing very much useful information. But outside of that, what we'll do is come to some of these decisions as a group. So we'll talk about what makes sense and how people are going to be able to use the data and make a decision collectively.
And is there a way to, and maybe you already have this, is there a way to have the main survey and then ask people if they'd be interested in taking part in a deeper dive into one of the sections?
We haven't done that in the past, but that's a really good idea. Because some people it's like pulling teeth to get them to take the survey, and some people want to talk to you for 2 more hours. So that would be, we could look into providing some postcards or something like that we give out afterwards and have a link there. I like that idea a lot.
Because this is recorded, Denver, do you happen to have a page that you can put up with that information that we can just have here in the recording? Or is it something?
Yeah, let me see if I can. Can you still see my screen?
Yes.
Yep.
I'm just thinking that, people that didn't join tonight will probably be making up the meeting. They'll go out and look to see what was discussed, and then they can still participate.
Okay. So I would suggest going to healthydurham.org, and I'll ask Marissa, the person who coordinates this site, to add the link that I'm going to give you in just a few minutes. But you can find, if you ever need to reach me, I can put actually my contact information in in the chat box before I leave, but this is Marissa's information, which can be found under the contact tab, and she would be the best point of contact for any of the committees that you're interested in joining, or you can find more information about them here. So if you want to know when the Access to Care Committee meets, you can click here. You can see their specific improvement plan. So this will have much more detail than what I went into regarding how they're going to address these issues between now and 2021. And then these are the co-chairs here. And you can, Marissa's information is here again. So any of these three people would be the people you'd want to get in touch with if you're interested in talking more about access to care. And then I also want to point real quick out, if you go to recent health data and scroll down, this is where you can see summaries of what we found from our conversations with people in the listening sessions. These have some data about each of the topics I just talked about. And then the full health assessment is available here, all 500 pages. So if you need any more specific information, it would be there. Yeah, and let me put real quick in here. Okay, so this is my first time using Zoom. I'm not sure how.
You can stop sharing, and then if you think.
Okay. Yeah, after I stop sharing, I'll be sure to, all right, maybe I'll just stop sharing now and I will add my information. Yeah.
Yes, when we post this, I believe that the chat will be shown. So.
Okay, cool. That sounds good.
Any other questions for Denver?
Denver, it's Kevin again. I don't know if you can share your screen again. Sorry to
Oh, sure.
Could you go, like, maybe introduce us to some of the infographics that you developed to kind of clarify the major trends of those health priorities that came out of the last community health assessment?
Yes, let me pull one up. Okay. Can you see my screen now?
Yes.
Okay, so I've just clicked on the access to healthcare and insurance infographic. There's one of these for each topic. And this tells you the percentage of people who thought this was a top issue. There's some specific data for Durham. And on the second page usually is where I've included examples of the ways residents want to see these issues addressed. And then there's usually a quote from a resident too that kind of captures the mood of what was talked about. So yeah, there's one of these for each topic. So I hope that you all find these useful.
They're really great.
Thank you.
Super helpful.
Yeah, good. I hope so.
Mm-hmm.
Thank you very much. Are there any other questions for Denver? If not, then I will share my screen.
Okay.
We thank you for taking your time to introduce us to the health assessment and really never thought about it for our community. So again, we just say thank you, Denver, and we like to give you a virtual certificate of appreciation for imparting valuable insight and inspiration as our guest speaker.
Thank you. That's really nice.
You're welcome. And with that, I'd like to ask our special guest, Pat Bridgers, would you like to say our four-way test?
Sure, say it with me and I'll just point each one out. So the four-way test are the things we think, say, and do. First,
is it the truth?
Second,
is it fair
to all concerned? Third, will it build goodwill and better friendships? And fourth, will it be beneficial to all concerned?
Thank you. And with that, I'll say good night, and we are going to stop the recording.